presentation.
Yes. Yes, ma'am. So I would like to call our first participant, Anmisha, to present it. Um, Anmisha, is you are in the meeting? Hmm. I think some network problem. I think we should start from the second participant. I would like to call Maurya Komal, our second participant, to please present your presentation to our judges.
Yes,
Maurya,
ma'am.
please go ahead, Komal.
Yes, I'm sharing my slide. My slide is visible to all.
Yes, Sneha, it is visible.
Okay. Okay, I'm starting. Sometimes small things are very dangerous. Did you know the smallest organism on the earth is a virus? Viruses are the smallest organism on the earth, but it shocked the whole world. Viruses are the smallest organism on the earth, but it has a too much power. It can destroy the whole world. We saw this in 2020. Therefore, we are familiar from a viral disease. However, good evening, everyone. First of all, thank you for the organizer committee who organized a presentation competition. Myself, Maurya Komal. I am student of SY BSc Biotechnology from BNN College, Bhiwandi. Today in this presentation, I would like to tell you about viral disease. Then I will move on the next slide, that is agenda of the day. First, I will introduce what are viral disease, and then after I will talk about who is the mastermind of this viral disease. And next, I will consider how the viral infection causes disease. After that, there is a disease of viral origin, for examples. And next, I will quickly summarize all of the things. Then next is what are the viral disease. We are talking about viral disease, then it is important to know what is viral disease. If we simply explain viral disease, is a disease causes by a virus invading in our body and multiplying the host cell, and it causes a normal symptom such as a fever, cough, running nose, and pain all over the body. For its treatment, we have to use antiviral medicines and take up prevention like wear a mask, use sleeps when coughing or sneezing. Some examples of disease like HIV, hepatitis, adenovirus, influenza, ablovirus, bacteriophage, etc. Now, next is who is the mastermind of viral disease. We are know who causes a viral disease is a virus. Then it is important to know about the what something about virus. Virus is a non-cellular genetic element that use a living cell for their replication. They cannot replicate outside of the living cell, and smaller virus is known as a viron. We know virus are the smallest organism on the earth, then it's obviously smaller than the bacteria. And if we consider structure of virus, there are four things we have to mention. First is lipoprotein envelope. Envelope is the main reason why our body cannot recognize virus, because every virus has a different envelope. Therefore, it is difficult for our body to recognize virus, and virus can easily causes a disease. The next is capsid, which is made up of proteins, repeated protein subunit, which includes the genetic material. And the virus have a genetic material, either DNA or RNA, but not both. Now, next is capsomers are arranged and highly repetitive pattern. A complete virus consists genetic material, DNA or RNA, and capsid surrounded. It's called a nucleocapsid. Based on this structure, it can classify into stages. First is isohedral, second is helical, and third is symmetric. First is isohedral. Then plane surface. Plane surface with equilateral plane are called the icosahedral structure. Some examples like poliovirus, adenovirus, rhinovirus. And next is helical. Helical is a capsid which includes a viral genome called a helical structure. Some examples like tobacco mosaic virus. Next is complex symmetry. Complex symmetry is different from icosahedral and helical. It synthesizes its own capsomer, which is a protein, and form a distinct shape and symmetry. For example, pox virus. Now, next is how does viral infection causes disease? We are talking about viral disease. We know viral disease causes by virus, but it is important to know how the viral causes infection in our body. For that, look at the picture. First of all, virus enter in our body through mouth, skin, nose, etc. It easily enter in our body. Then next, it enter in the host cell, which there it replicate, synthesize own mRNA, and which is converted into protein through the process of transcription and translation. Now the viral protein is made, and the virus is assembles. Now it causes our function, which causes the cell damage, like host cell death, cell transform into tumor cell fusion, metabolic alteration. Overall, this process make our infected person cell damage. Therefore, immune system cannot produce any antibiotic which kill the virus, and virus easily causes the disease. After that, the main important point, examples of disease. Without example, we cannot understand what are the viral disease. The disease of viral origin. First, I will talk about influenza. Influenza is causes by Maxovirus influenza. It transmits through droplet, and its person experience symptoms like fever, headache, sore throat, sneezing, and pain over the body. If influenza is neglected, then it converted into pneumonia, which are very dangerous, and sometimes it causes death also. The person suffer from influenza 2 to 4 days. For treatment, we have to use antiviral medicine, take a rest, use a clean boil water, and follow the prescription. Sometimes we not follow the prescriptions, therefore we our disease is not clear. Therefore, we have to follow prescriptions. Now, next is polymyelitis. Polymyelitis is caused by poliovirus. It's transmit through houseflies, fecal oral routes. It's enter the body alimentary canal, in which they multiply and reach the nervous system through bloodstream. Its harmful effect is a attack of paralysis and with fever. Start with fever, and then it convert pain all over the body and the paralysis. If the person infected by polio virus, then it is not possible to cure from this disease. For treatment, government established immunization program. It includes vaccination of all children under the age 5. Oral polio vaccine, Salk vaccine, injectable polio vaccine, which is also called 7 vaccine, and polio drop. It is said to be that 2 drop of life. And next is a chickenpox. Chickenpox is caused by varicella zoster virus, and is transmitted through droplet, fumate, direct contact. Its symptoms is a fever, itching, rashes on the skin, etc. Its incubation period is 1 to 2 days. For treatment, there is a vaccine called Aclovir and Ocastans. Look at the picture. There is a rashes on the skin, which is called a chickenpox symptoms. Now, next is rabies. Rabies is caused by rhabdovirus, and is transmitted by a bite of an infected animal. If the animal infected, it can bite you, then it causes a rabies. Examples: dogs, jackals, wolves, and cats. Its normal symptoms is a fever, headache, excess salivation, muscle pain, paralysis, and mental confusion. And most important is fear of water, which is also called a hydrophobia. Rabies is 100% fetal. If the person infected from rabies, it's infected from few days to more than a year after the bite is happened. Although there is no effective treatment, one symptoms are there, but there is some vaccines for 5 doses of vaccine, which is administered over 28 days. It is also important to vaccinate your pet dogs, which not causes any infection. Then next is hepatitis. Hepatitis is the inflammation of the liver. Hepatitis is caused by hepatitis virus. If the hepatitis A, then virus A, B, C, D, E respectively. If and hepatitis A and E transmitted by the ingestion of contaminated food and water with fecal matter. Hepatitis B, C, D, it transmits through blood transfusion, sexual contact, and various fluid. Symptoms is the skin, yellowing of skin and eyes, vomiting, stomach ache, dark urine, fatigue, liver crisis, etc. Type B and C lead to chronic disease. For treatment, there is a tablets for hepatitis B, tenofovir alpha amine tablet. For hepatitis E, there is a vaccine which called hepatitis A vaccine. For hepatitis E, there is a Sovalite tablet. It's now next is coronavirus. We are all familiar with coronavirus. Now we are talk about immunity. We are focused on our health after the coronavirus. Then, because we are also from quarantine, we know how the virus, and this virus is proof the power of virus. Coronavirus are the largest family of virus that causes illness ranging from normal cold to pneumonia. In sometimes there is a causes that also. It's not causative is in SARS-CoV-2, and it's normal transmission through contact, droplets, airborne, fomites, fecal air, blood-borne, mother to child, and animal to human. Its symptoms is a fever, cough, stomach pain, stomach ache, diarrhea, headache, low taste of or smell, running nose, muscle pains, etc. Uh, Along with the medicine, it is also important to take a preventive measures if you are infected from coronavirus. Wear a medical mask, wash your hand properly, use your hanky during sneezing or coughing, avoid touching your face, keep 1 meter away from sick people, stay at home until recover. There is a vaccines for treatment of coronavirus, Covishield and Covaxin. Now next, if we conclude all the virus disease, then we understand the virus is a disease causes by a virus. And the causative agent is virus is transmit directly droplet, direct contact, vomit, ingestion of contaminated food and water. And its normal symptoms of every virus is sneezes, rashes, headaches, vomiting, body pain. If you want to, and its treatment is antiviral medicine. Along with the treatment, we have to take a preventive measure. That is, avoid touching your face. Always wash your hand before eating and using bathroom. And most important, get vaccinated. During coughing and sneezing, use your slips. Thank you. This is all about the viral disease. Once again, thank you for attention. And once again, thank you for the organizer committee who organized a beautiful event.
Thank you, Komal. Now, I would like to call our next participant, Nishat Sanjay. Nishat, is I audible to you?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
Please start your presentation.
Sure, ma'am. Ma'am, let me present my screen. Script. Okay, ma'am. Is it visible?
Yes,
Hello.
it is visible.
Okay, ma'am. So, starting with my presentation. Okay. Viral disease. So, in this presentation, we will talk about viral diseases, how these diseases are caused, and what are the viruses and which are types of viruses. So, without wasting time, I start with my presentation. So, first is what are viruses? Viruses are simple cellular entities consisting of one or more molecules of either DNA or and RNA included in a coat of protein. Means simply they are molecules of DNA or RNA and they are enclosed in a protein coat. So what are the properties of viruses? They are acellular entities. Means viruses are basically a acellular structures. They lack cellular structure. They don't have any kind of cellular cell organelles like ribosomes, nucleus, and all. Then viruses are obligate parasites, means they need some prey to live on that. And viruses are very much host specific, means some viruses are strictly plant viruses. They only infect plant and they can't infect animals. Uh, Shape is icosahedral. Icosahedral means they have a icosahedral symmetry, some coordinates and faces. Then helical means they have helix-like structure. Envelope viruses and the complex viruses. Then coming to genetic material, which is also known as a classification based on genetic material or Baltimore classification system. Here, viruses are classified on the basis of ssRNA, dsRNA, means their whatever genetic material present in that viruses. And then coming to next story, another classification is host viruses. Sorry, depending on the host, viruses can infect. First is bacteriophages. They can infect bacteria. Example is T1 phages, T2 phages, T4 phages, coliphages. Some are plant viruses like tobacco mosaic viruses, potato tuber viruses, like that. And another last one is human or animal viruses. Example: rabies virus, HIV virus, Rota virus, and influenza virus. So, in the viral infection, main thing is to detect virus. And what are the methods to detect virus? Here, the widely used method is polymerase chain reactions. Here, PCR techniques, polymerase chain reaction is in short called as a PCR. So, PCR techniques are widely used in viral detection. It detects viral genetic material. And there are types of PCR. First is quantitative PCR, then reverse transcriptase PCR, RT-PCR, and a real-time PCR. And another method is serological test. Here we use a serum of patient to find out viral antigen, or some in a successful infection, the host produces antibodies against viral antigens. So we in the serological test we either check viral antigens or antibodies against viral antigen. The common type is ELISA test, enzyme linked immunosorbent assays, and then other methods are viral culture, immunofluorescent assay, mass spectroscopy, and final method is genome sequencing, which is already latest. Then plant viruses. Here are some examples of plant viruses that we can see: tobacco mosaic viruses, potato viruses, cucumber mosaic viruses. Such viruses infect plant mainly. Then coming to next story. What is the transmission and pathogenesis of plant viruses? First is transmission. See, uh, method of transmission is first method is vector transmission. Some insects like flies, fruit flies, then aphids acts as a insect vector to transmit virus. Then some mechanical transmissions means if we use tools to cut infected plants and we use these tools against the normal plant, the virus can be the virus can be spread through the that tools contact with infected plants and by human touching. Seeds. If the infected seeds can transfer viral disease and graft. If we graft some plant using the infected sapling, then the non-infected plant will also suffer the viral disease. Basic pathogenesis of, or this is not a very much specific pathogenesis because viruses are very much notorious and they have a large variety of infection and pathogenesis. So this is a very much what we can say general pathogenesis, not a specific pathogenesis. Infection, firstly they infect, then replication, they replicate in the host cells, and symptom development, they develop symptoms in the plants and the spreads. They spread to another plants. So, what are the different mechanisms against plant viruses? These virus plants some mechanisms against the viruses. So, first is RNA silencing. Plants targets the viral RNAs and degrades viral RNAs. Then hypersensitivity reaction. Plant induces localized cell death to prevent viral spread. Then pathogen associated molecule pattern. In here the according on the basis of molecular pattern of viruses, plant encounters viruses by triggering immunity and systemic acquired resistance. Here, infected plant producing immunity in non-infected parts. Means some plant part is infected with virus, then this plant will trigger some immunity to save non-infected parts. In next slide, what are the preventive measures in plant viruses? First is isolation measures. Isolate infected plants from another plants. Then vectors management. Uh, by pest control measures, we can manage the vectors. Then crop rotation. We should practice rotational method for crop cultivation. Virus-free planting materials. We should use sanitized or disinfected material for agriculture use. Good practice. Farmers should perform good practice and destroy infected plants. If the plant is infected, then better way is destroy it. Then coming to story of animal viruses, here I have list some common viruses or common infections. First is SARS-CoV-2, which is well known, and due to this, we are to the point of that virus uh, here. This target organ of that SARS-CoV-2 is respiratory system, especially as you know, the cells S receptor 2. Then mode of spread is infected droplets. In cattle, there is a big disease of lumpy skin virus or lumpy virus. So it targets skin of cattle, and mode of spread is direct contact or insect vectors. HIV virus immune system, it is a sexual transmitted infection. It also spread through infected blood and syringes. Rabies, which affects the CNS, and it spread with dog, cat, and monkey bite. Then hepatitis A virus, hepatitis B virus, hepatitis C virus, and hepatitis virus family. Target is liver, and mode of spread is contaminated food and water. Other you can read. Just I want to clear one point that these are the target organ, but once they take charge of that cell, they replicate in it, and after that they start to infect other parts also. Then here is a general pathogenesis of animal viruses. Please see very carefully. Once they enter into our body, they find suitable cell to attachment, and after attachment, they encounter cell mechanism. They take a charge of cell mechanism, and they start to replicate their protein and genome. Um, and after that, coming to the life cycle of viruses, they assemble in the that particular host cell, and they release out by burst opening that cell, and they find no cells to attachment. Now, as they enter in our body releases primary response, non-specific response, innate immunity against that viruses by first is physical barrier, skin, mucus, and gastrointestinal layer. Then phagocytosis, then complement fixation, complement pathways are start against that virus and natural killer cells. In coming to the adaptive response, specific response, once they start genome replication and protein replication, viral antigens are presented on MHC2 molecule, measures the compatibility protein molecules type 2 to CD4 plus T cells, and the activation of T cells takes place. Here, B cells directly recognize viral antigens, and they get activated. With the help of T cells, B cells produce plasma cells. These plasma cells produce antibodies, and these antibodies are these antibodies help to the kill that virus and present that virus is presented to other immune cells to further destroy it, and production of memory cells will take place. Then what are the precautions? See, there is no specific treatment for the viral disease. So better is prevention is better than cure. So first is hygiene. We should take care of our personal hygiene, our social hygiene. Then vaccination. Vaccination is the key to save us from the viral diseases, and quarantine. If some got viral disease, the quarantine him or get quarantined. Then monitor our symptoms. If we know if we have some viral disease, then please monitor it Then early detection. Main cause of death due to viral disease is the detection of virus is very late. Some viruses are also very latent in nature, like HIV viruses and all. But early detection is very important. And awareness among the people regarding viral disease is a very much important in the that epidemiology of viral disease. Then coming to next point, what is the treatment? The supportive care. We should take supportive care according to our health, according to symptoms, and try to relieve symptoms. Other things will immunity or immune system will take care of it. Immunotherapy such as a monoclonal antibodies, then quarantine and hospitalization if needed. Prevention of secondary opportunistic infections. Some are opportunistic bacteria, or they can cause a secondary infection or opportunistic infection. So we should take antibiotic therapy against it. And it is found that in some cases vaccination is also helpful in treatment of viruses. So sometimes vaccination is performed. And last but not the least option, because there is not a specific antiviral medicines are available, and some antiviral medications have a adverse side effect on the immune system. So uh, it's the last option to take antiviral medication. Here are some references which I have referred to made these slides. All the images are I have taken from Wikimedia Commons and other copyright common copyright laws. Here, thank you. This is the last slide, and you can see how our body is fighting with that viruses. End of the slide. Okay. Thank you. Over to you.
Thank you, Nishat, for, for giving us such a wonderful presentation. Now, I would like to call our next participant, Sneha Budaria. Sneha,
Yes, ma'am.
it's up over to you. Please present your presentation.
Okay. Just hold on for a second. Let me share my screen.
Okay, okay.
Is my screen visible to everyone?
Yes, Sneha, it is visible to everyone.
A very good evening to everyone present here. I'm Sneha Budaria and I'm from Women's College, Ranchi. Today I'm going to talk about viral diseases. As we all are aware about our bodies and our health, but we don't focus on what kind of action should we take for a good health and we should proceed for a better lifestyle. Everyone talks about yoga, mental peace, but no one talks about our hygiene, our daily lifestyle, our food habits, and especially the very most important thing, the surrounding we live in. So, I'm going to talk about the virus that are literally very tiny, but that create a major aspected stuff in our body. So, viral disease are caused by viruses. They impact our whole body, but they majorly focus on few systems that gets affected and ruin our body very harshly. That is respiratory system, digestive tract, and skin. Viruses are the most infectious agent that are very much small. They are made up of a piece of genetic material, DNA and or RNA that is enclosed in a coat of protein. A viral disease is any illness or health condition that is caused by a virus. They are contagious. They are only not only surrounded or transferred by people to people, but they are transmitted to other person through their personal stuff. Like either we touch someone's comb or any stuff of an infected person, we adapt that. We get that in our body, and we don't notice that that comes to a conclusion when we get ill and we get suspected by the doctors that we are infected by viral disease or the virus. So I'm going to talk about different types of disease caused by viruses. Majorly, we are not aware about the viral disease or the virus at our young stage, but the moment a person gets acknowledged by the knowledge, can know about everything in detail. The first is respiratory viral disease that is contagious as well as that can be transmitted by one person to another with the personal stuff. It affects our upper or lower part of respiratory tract, and the symptoms are runny or stuffy nose, coughing or sneezing, fever or body ache. And because of respiratory viral disease, we get flu, common cold, respiratory syncytial virus infection, adenovirus infection, parainfluenza virus infection, or the most common SARS, that is severe acute respiratory syndrome. Transmission Transmission is done either by the spread of droplets, that is during the coughing or sneezing moment, or through the committed stuff of our useful things, that is tabletops or personal items. So the treatment of viral disease is not very much assured that you will get out of it, but you can either try for the better hygiene condition, you can maintain your personal hygiene very well, go for the vaccine for seasonal fevers, or OTC medication can be done for nasal deconizations, or you can do one very common stuff that you can use the regular Ayurvedic step at your home. You can try to develop a good habit for your benefits. The second one is gastrointestinal viral disease. That affects your digestive tract. It is also contagious as well as it can be affected by your personal stuff. It leads to stomach flu and symptoms are very normal: abdominal cramps, diarrhea and vomiting. And it causes norovirus infection, rotavirus infection, and many more things can be done to prevent this virus. And we can wash our hands after every single deeds we do. And for rotavirus, children get vaccination during their vaccination schedule at their early stage. Then we have xanthematous viral disease that is causing skin rashes and it is too contagious, especially the measles virus. And examples are rubella, chickenpox, roseola, smallpox, and fifth disease. And the very worst scenario comes when we get chickenpox at our early stage, because chickenpox just destroys our body temperature and makes ourselves ill for at least a week or more than a week. Treatment is fever reducing medication, that is acetaminophen, can be given to them, or antiviral drug, that is acyclovir, can be given to everyone. The next one is hepatic viral disease. It is the inflammation of our liver, that is viral hepatitis. And examples are hepatitis A, B, C, D, and E. Treatment is very much common to other viral diseases. It is contagious, especially the hepatitis B and hepatitis C. Hepatitis B is usually caused by sexual contact. Hepatitis E and A can be adapted in our body through food or water. Hepatitis E is only developed when you have hepatitis B. Transmission of hepatitis B, C, and D can be cured off by antiviral drugs. Hepatitis A and E can be done through plenty of water and take plenty of rest. Drink fluids as much as you can so that you can avoid your loss of body hydration and avoid alcohol. Vaccine for hepatitis E is available, but it is only available in the US. And try to not share your personal utensils with anyone. Have safe sex. Avoid infected food and drink. Then we have cutaneous viral disease. Cutaneous viral disease causes lesions or papules to form on skin. It is contagious, can be removed by cryotherapy. Prevention can be only done by your good hygiene habits. As every viral disease needs fever, conclusion, drowsiness, seizures, or coordination problems. Examples are polio. Transmission is many neurological viruses are spread through bites, insects bites you either the mosquito or the tick. Other viruses are poliovirus or enterovirus are quite contagious and spread through other persons too. Contaminated objects can contribute to the spread of these viruses as harshly. So avoid touching anything that an infected person have touched already, or try to have your stuff with you traveling to any other new city or new places. Treatment for this can be take plenty of rest, stay hydrated, and take OTC anti-inflammatory to ease pain. Polio or at severe cases may require a breathing assistant or IV fluids. Prevention for these can be vaccine, good hygiene, avoid close contact, protection against insect bites, and keep pets vaccination. Keep your pets completely vaccinated so that you can be cured of rabies. Your pet should get the personal care. Thank you for providing your time and be sincere for listening me.
Thank you, Sneha. Now, I would like to call our next participant, Abhilash. Abhilash, is I'm audible to you, Abhilash? Uh, If is there any network issue, Abhilash?
Hello.
Yes, you're audible, Abhilash.
Okay, I'm sharing. Okay.
Yeah, start. Please start your presentation.
Good evening, all. My name is Abhilash. I am from Madras Christian College, Chennai. Um, First, in viral disease, I'll say that viruses are the smallest unicellular organisms that they are obligate intracellular. They
One
possess.
minute, Abhilash, your screen, your presentation is not visible. We can only see the Google, your this cover screen.
Okay, one second. It's visible now.
No,
No, Abhilash. No, it's not visible. Try again to present it, Abhilash.
One second. They're not allowing. Don't know what happened. One second.
Abhilash, if there is any problem, you can send me your presentation. I will present it and you start saying about it.
No, no. 1 second.
Okay, okay, try.
I'll connect from my phone. Hello?
Yes, Abhilash?
Yes, I'll connect from my phone, okay?
Okay, okay, Abhilash, no problem.
Hello, ma'am.
Yes, Abhilash.
I'm audible?
Yes, yes, you are audible.
Ma'am, can you go with the next participant? I'll give on the last.
Okay, Abhilash, no problem.
Oh, okay.
Okay, now I would like to call our next participant, Khushi Sharma.
Yes, ma'am.
Okay, Khushi, can you start you with your presentation?
Yes, ma'am. First of all, good evening to all. I am Kushi Sharma from Ranchi Women's College, BSc Biotechnology, and I am going to give my presentation on viral diseases. So, first of all, I will give some introduction about viruses and what are viral diseases, its cause, symptoms, prevention, treatment, and different type of viral diseases. So, viruses. What is viruses? Viruses are small germs, pathogens that can infect you and make you sick. They can infect humans, plants, animals, bacteria, and fungi. Each one infect only specific type of host. Viral infections in human can cause no symptoms or make you extremely ill. Some viral diseases show no symptoms. These types of diseases they can cause include respiratory illness, diarrhea and vomiting, sexually transmitted infections, skin conditions, etc. A virus is a small piece of genetic information in a carrying case. They carry genetic information. They have a protective coating that is called capsid. Viral diseases. Viral infections are among the most common afflictions of man. It has been estimated that children experience 2 to 7 respiratory infections each year. Adults are afflicted with one of the three such episodes. Viruses cause familial infectious disease such as common cold, flu, or rats. They also cause severe illness such as HIV, AIDS, Ebola, influenza, and COVID 19. Some of these are very dangerous, which even can't be treated and lead to death. Causes Cause of viral diseases. Viral diseases are mainly caused when a virus enters the human body and uses the host machinery to reproduce. They enter the host body and start reproducing and spread all over the body. If the body's immune system fails to fight against the viruses, it multiplies and spread to other cells, causing infections. Some symptoms of viral diseases are: symptoms of viral infection depend on where you are infected, but some common ones include flu-like symptoms, fever, head and body aches, fatigue, etc. Upper respiratory symptoms, sore throat, cough, sneezing, digestive symptoms, nausea, vomiting, diarrhea, skin conditions, rashes, sores, blisters, rats. Many viral infections don't cause any symptoms. Prevention. Viral diseases can be prevented by taking some precautions, like one of the best way to reduce your risk of a viral illness to get vaccinated. A healthcare provider can tell you which vaccinations are recommended for you. Vaccinations are available for many viral diseases such as chickenpox, COVID-19, hepatitis A, hepatitis B, human papilloma virus, flu, influenza, or rotavirus. Other ways to protect yourself and others from viruses include: wash your hands frequently, especially during cold and flu season. Practice safe food habits. This includes storing food properly, heating meat and poultry to a safe temperature, and washing or peeling fruits and vegetables before eating. Use a condom or dental dam during any kind of sex. Protect yourself from bug bites. Wear protective clothing. Use bug spray and sleep under mosquito netting if necessary. Don't handle wild or aggressive animals. Don't leave your pet outside unsupervised where they could potentially get bitten by an animal with rabies. Avoid being around other people if you are sick. So these were some precautions that you can take to prevent yourself from viral infections. Now, what are the treatments? Many viral infections resolve on their own and don't require treatment. Other times, viral infections are dealt with by symptom relief alone. Some medications work directly on the viruses, known as antiviral medications. They act by inhibiting the production of viruses particles, preventing multiplication of viral DNA or viral particles from entering host cells. Different antiviral medications are used for the treatment of chickenpox, HIV, HSV1, HSV2, hepatitis B, and influenza. So now there are many viral diseases. As, so what are the types of viral diseases? Respiratory viral diseases. These cause respiratory disease like respiratory viral infections affect nose, lungs, and airway. They spread by inhalation of droplets containing virus particles. Frequent hand washing, covering your nose and mouth while coughing or sneezing, and avoiding contact with infected people help prevent the spread of respiratory infections. Avoiding touching your nose, mouth, or eyes and disinfecting hard surfaces also helps. Rhinovirus. The most commonly causes the this most commonly causes the common cold along with 200 other viruses. Symptoms like coughing, sneezing, headache, and sore throat usually last for 2 weeks. Seasonal influenza. This affects a significant percentage of the population over world. The symptoms are more severe than the common cold and include body aches and severe fatigue. So these were some respiratory infections. Now what are viral skin infections? Viral skin infections show symptoms like rashes or bumps. These viruses are caused by skin to skin infection, through though some are airborne too. Using shared towels, communal swimming pools, or put you all put you at risk to catch these viral infections. Now, what are foodborne viral infections? Hepatitis A. This viral infection affects the liver for a few weeks to several months. Symptoms include jaundice, yellowish discoloration of the skin and the conjunctiva, nausea, loss of appetite, and diarrhea. Rotavirus. Rotavirus causes severe watery diarrhea, which can lead to dehydration. This most commonly infects babies and young children. These were some foodborne viral diseases. Now, what are sexually transmitted infections? Sexually transmitted viral infections spread through contact and body fluids or blood. What are what, human papilloma virus? It is a common sexually transmitted infection. Different subtypes of HPV exist. While most cause genital rats, others can increase the risk of cervical cancer. Vaccination can help against most cancer-causing strains of HPV. Hepatitis B. This causes inflammations of liver and is transmitted through contaminated body fluid. Some people don't show any symptoms when infected, while others can have nausea, vomiting, jaundice. Hepatitis B is a chronic infection that can lead to liver cancer. The vaccine against these viruses is 90% effective. Human immunodeficiency virus (HIV). This virus affects cells of the immune system. Progression of the disease reduces the body's ability to resist disease or infections, leading to acquired immunodeficiency syndrome (AIDS). So sexually transmitted diseases are most dangerous, which cause cancer. So thank you. Thank you, ma'am.
Thank you, Khushi. Now, I would like to call our next participant, Shifa Farooq. Shifa,
Yes, ma'am.
please present your presentation.
Yes. Um, my screen is visible.
Yes, Shifa, it is visible.
Thank you. Good evening to one and all. I am Shifa Farooq Siddiqui. The topic name is for viral disease. As we all know that the viruses are very tiny germs that are made of the genetic material, either of the DNA or RNA, inside of the protein code. And basically, it affects the human, not also human, but animal also. And some of the diseases are common cold, flu, COVID-19, HIV, uh, Marburg virus, Ebola virus, Hanta virus, bird flu virus, and many more. These are the basically dangerous virus. I'm going to discuss in detail the one that is Marburg virus. First, we have to know actually where it is come from and how it is infected. Basically, it is come in 1967 from the African green monkey that were imported from Uganda as a pharmaceutical use. In that city, Uganda, in 1967, it is reported that 32 cases and 7 dead. That time, the government know this disease and the life-threatening disease of Marburg virus. Next come and how it is previous outbreak of Marburg viral disease. In as we said that in 1967 the disease has come in. First case was in Uganda to 2012. There are many cases come from this disease, and it is really life threatening from many such as the Congo, Gabon, Sudan, and Uganda. The largest outbreak was known in 2005 in Angola with 252 cases and 227 deaths. Next for 2007 to 2017, the outbreak was done in Uganda again with the foreign travel. That time, the government restricted the international boarding and roading as the coronavirus has come from the different states. Uh, same, same the level it is treated for coronavirus. The Marburg virus also, the country had decided we should stop the international loading and boarding so the disease not come from another way. Okay. Next come to the key factors of Marburg virus. First was it belonged to the non-segmented negative strain RNA virus, which is very dangerous. Next come to the it is fatality ratio of up to 88%, which is lower and what is happening in this? The Marburg virus is a disease which is cause fatality ratio of up to 88%, but can be much lower with good patient care. Marburg virus was very similar with the Ebola virus. Both members has belong to the same family, that is Filoviridae family. So caused by different viruses, the two diseases are clinically similar. Both diseases are rare and have the capacity to cause outbreak with high fatality rate. Two larger outbreaks has occurred simultaneously in Marburg and Frankfurt. The two diseases have come simultaneously and it leads to the outbreak. Next come to the structure. Basically, it is pleomorphic and rod-like structure with branch and with different length and diameter. Next come to how it is transmitted. You see, basically, initially, human Marburg virus infection result from prolonged exposure to mines and caves inhabited by research bed colonies. Marburg spread to human transmission by direct contact through broken skin or mucous membrane with the blood secretion, organs, or other bodily fluid of infected people and with surfaces material. Example, bedding, clothing contaminated this fluid. Next, come to the healthcare. The healthcare workers have frequently been infected by treating patients with suspected to confirm Marburg virus. This has been occurred through close contact with patients when infection control precautions are not strictly practiced. What is happening in this? The transmission by contamination injection equipment was neither sick injured is associated with the severe disease such as the rapid deterioration and possibly a higher fatality rate. People remain infectious as long as the blood contains the virus. Next come to the symptoms. As the incubation period of this is interval from infection onset of symptoms, basically from 2 to 21 days. Illness caused by Marburg virus began abruptly with higher fever, severe headache, and severe malaise. Muscle rashes and pain are the common features of this disease virus. Severe watery diarrhea, abdominal pain, cramping, nausea, vomiting on third day. Next, the diarrhea has persisted for a week and the appearance of patient was faced ghost-like. Drawn features, deep-set eyes, expression faces, and extreme lethargy. In 1967, European outbreak was done. What happened in this? The non-itchy rash was a feature noted in patient between the 2 to 7 days after onset of symptoms. Next, from 2 to 7 days. Now come to the manifestation. Hemorrhagic manifestation between 5 to 7 days. What is happening in this? It is a fatal case. Continuous bleeding from multiple areas. Flesh, bone, blood in vomit, feces in other, often accompanied by bleeding from the nose, gums, and vagina. And due to spontaneous bleeding at venipuncture site, that is the intravenous access, which leads to the troublesome. During this severe phase of illness, patients have sustained higher fever. Involvement of central nervous system can result of confusion, irritability, and aggression. Due to inflammation, it has reported that occasionally late phase of disease, that is 15 days. Now come to the in fatal cases, that is the between the 8 to 9 days. What happened in this? Usually they lead to severe blood loss and shock. Due to this, person may go in coma and multiple organ failure from this. Next, come to the identification. How we can diagnose this disease by using different assay. Confirmation that symptoms were caused by the Marburg virus infection are made by using diagnostic methods such as the antibiotic capture enzyme link immunosorbent assay. Next was the antigen capture detection test. Next, serum neutralization test. Next, reverse transcriptase polymerase chain reaction. And we can see with the help of electron microscopy. Next, from virus isolation by cell culture. Samples collected from patients are the extreme biohazard risk. We have to follow the biohazard guidelines to collect the sample. Laboratory testing on non-inactivated sample should be conducted under maximum biological containment conditions. All biological specimens should be packed according to the transported nationally and internationally. The sample was transported. Next, come to the treatment and prevention. Basically, currently there is no vaccine or antiviral treatment approved for Marburg virus. However, the supportive care rehydration with oral intravenous fluid is generally going on with treatment of specific symptoms and improved survival. But there are monoclonal antibodies available under development and antiviral. Example, remdesivir and favipiravir. That has been the clinical studies of the Ebola virus disease, which that could be tested for Marburg virus. As I already told that Marburg virus was very similar with the Ebola virus, so the treatment was given to the Ebola virus. The scientists had thought we should try with the Marburg virus also. In May 2020, EMA granted a marketing authorization that Zabdino and Mavabia against Ebola virus. The Mavabia virus contain Vaccinia Ankara Bavarian Nordic, that is MVA, which has been modified by produce 4 protein from Zar Ebola virus and other viruses. Florida. The next, the vaccine could potentially protect against the Marburg virus, but its efficacy has not been proven in clinical trials. Marburg virus. Next, what is happening in this? As I already told that currently there is no proper vaccine available for this virus, and we should take social distancing, proper isolation from infected person. The doctors that treating the patient should take care of themselves. And as we all know that in coronavirus, everyone know that quarantine, the doctors have used PPE kits, etc. To save them from the infected person. Now come to this social and economic impact. Any virus come in the city, state or country, it is leading to the lack of first of all awareness among the people. Some people are saying that it is the myth, and some tell that it's the Andhvishwas type, that the Marburg virus generally due to the limited people don't know about this virus. Due to this, the villages especially don't know about this. They thought that it is the myth and the Andhvishwas type. Next, come to the culture differences and believing that leads to the death. From 2 to 21 days, the person is not treated properly. Basically, first of all, it is vaccines were not available. The person may die due to because of continuous bleeding. Next, come to the economic impact. Any disease or virus has come, it has the social and economic impact. Due to some infodemic also, people were searching here and there and listening to the wrong people, and the spread of infection was from one person to another person. Next to the proper
Your time
management.
is over, Shifa.
Yes, ma'am.
Time to wrap up. Yes.
Yes. Next to the proper management should be done to prevent and control the risk of it, and travel restrictions should be done tourism and global businesses. Thank you.
Thank you, Shifa. Now, I would like to call our next participant, Shamim.
Yes, ma'am.
Please start, Shamim.
Yes, ma'am. I'm audible?
Yes, you are
Hello?
audible, Shamim.
Screen is visible?
No. Yes,
Just a
ma'am.
minute. My screen is visible now?
No, Shamim, it's not. Swapna, ma'am, you're saying something?
Just a minute, ma'am.
Okay, Shamim.
Now is it sharing my screen?
Yes, it is visible.
Yes, ma'am. Hello. Good evening to all of you. I am Khan Samim Arbaz. Today discuss about the viral disease. First, so what is viral disease? So viral disease are infection caused by virus. Different type of virus caused by different infection. The common cold is the most common type of viral infection that is caused by infection in the respiratory tract. Other viral diseases include chickenpox virus, herpes virus, influenza virus, AIDS, mumps, measles, and viral hepatitis. There are some categories of the viral disease. Including the first category is the respiratory viral disease. The respiratory viral disease are contagious and commonly affected lower and upper part of the respiratory tract. There is some symptom of this disease. There are nose, coughing, sneezing, fever, body rashes, etc. There is the example of this disease virus is the flu, common cold, respiratory syncytial virus infection, adenovirus, etc. The transmission of the disease, the respiratory virus are spread by the droplet zoonosis through the coughing or sneezing. If someone with a viral illness cough or sneeze nearby and we inhale this droplet, so we may develop the disease. This virus can also be spread through the contaminated objects such as doorknob, tabletop, and personal item. If we touch one of these objects and then touch our nose or eye, so we could develop this disease. There is the treatment of this viral disease. The respiratory viral disease usually heal on their own, but the over-the-counter medication, including nasal discongestion, cough, suppression, and pain relievers, can help to reduce symptoms. In addition, Tamiflu, an antiviral drug, is sometimes prescribed if someone is in the very early stage of developing the flu. The prevention, the best way to avoid respiratory viral disease is to practice good personal hygiene. Wash hands often, cover mouth when cough or sneeze, and limit interaction with the people who show the symptom of the respiratory condition. There is also vaccine can help to reduce the risk of this viral disease. Now the next category of this viral disease is the gastrointestinal viral disease. In this disease affect the digestive tract of the human. The viruses that cause them are contagious and usually lead to a condition called gastroenteritis, also called as the stomach flu. There is a common symptom of the disease: abdominal cramps, diarrhea, vomiting. For example, of this disease virus, uh, norovirus infection, rotavirus infection, and some adenovirus also involved this disease. Transmission of this disease: gastrointestinal virus are shared in the stool during the bowel movement. Food or water that been contaminated by the feces can spread the virus to others. So we can also get the virus from sharing utensil or personal object with some who has a virus. Treatment of the disease: there are not any treatment for gastrointestinal virus disease. If many cases, they resolve on their own within 1 or 2 days. There is a prevention of the disease. So we can prevent this disease by the washing hand, especially after using the bathroom, and wiping down contaminated surface, and not sharing personal item or eating utensil can also they help reduce the risk of this viral disease. There is the other category of this is the exanthematous viral disease. This disease causes skin rashes. Many of them cause additional symptoms as well. The many of virus in this category are highly contagious. For example, Bacillus virus, rubella virus, chickenpox and smallpox virus, and chikungunya virus. Transmission: the many this disease virus are spread through the respiratory droplet from the cough, sneeze of someone with the virus. Other viral diseases such as the chickenpox, smallpox can be transmitted by the coming into the contact with fluid, broken skin lesion. Sorry. Chikungunya virus is spread through the mosquito bite and cannot be transmitted from the person to person. Treatment of this disease are: the viral disease focus on managing symptoms, fever reducing medications such as acid aminopin can help in the treatment, and antiviral drugs such as isoclavir may be given for chickenpox or shingles. Prevention: the measles, rubella, chickenpox, smallpox can be prevented through the vaccination, and reduce the risk of chikungunya virus infection by protecting ourselves from mosquito bites. Next category is the hepatic viral disease. The hepatic viral disease causes inflammation of the viral known as the viral hepatic. The most common trust source type of viral hepatitis are hepatitis A, B, and C. Sorry. It is worth noting that this is caused by the other viruses such as cytomegalovirus, and the yellow fever virus can also affect the liver. For example of hepatitis A, B, C, and D, E virus include in the hepatic viral disease. Transmission of this disease are: the hepatitis B and C can be transmitted from person to person through the bodily fluid and sharing items that come into the contact with blood, needles, razor, etc. And also hepatitis B can be spread through the sexual contact. People get hepatitis A and E by consuming food or water that has been contaminated with feces from someone with their virus. Or we can only develop hepatitis D if we already have the hepatitis B virus. Treatment of this disease: the hepatitis B, C, and D focus on managing symptoms. In some cases, a doctor might prescribe medicine such as antiviral drug. Next, the prevention of this disease are the vaccine for both hepatitis A and B. There are also vaccine for hepatitis E, but is not available. Other way to prevent viral hepatitis include not sharing needle, razor, and practicing self-check, and avoiding the food or drink may be contaminated by fecal. Next category is the hemorrhagic viral disease. Hemorrhagic viral disease are severe condition that involve damage to circulatory system. Symptoms of a hemorrhagic viral disease include high fever, body ache, weakness, bleeding under the skin and mouth or ear, bleeding in internal organ. Example of this disease: viral Ebola, Lassa fever, dengue fever, yellow fever, Marburg, hemorrhagic fever, etc. Transmission, the some hemorrhagic viral diseases such as dengue fever and yellow fever are spread through the bite of an infected insect. Others said Ebola spread other people through the contact with blood and other body fluid, someone with the virus. Lassa virus, Lassa fever is spread through the inhaling or consuming dried fecal or urine or rodent, etc. Treatment, there is no specific treatment for hemorrhagic viral disease. It is important to stay hydrated if you have viral hemorrhagic disease. Prevention, researchers are in the process of developing vaccine for several hemorrhagic virus. A yellow fever vaccine is currently available for people traveling to area where yellow fever is common. If you live or work in an area where viral hemorrhagic disease are common, we can do following reduce risk. Use proper protection such as gloves, glasses, head cap, uh, face shield, etc. Avoiding biting by insects, especially mosquito and tick, by wearing protective clothes or using insect repellent and protective eyewear. Protect against rodents by keeping food cover, removing garbage often, and making sure window and door are secure properly. Now, the next category is a neurological viral disease. Some virus can infect the brain and surrounding tissue, causing neurological disease. This can result in a range of symptoms: fever, confusion, seizure, coordination problem. There is an example of this disease of poliovirus, meningitis viral, encephalitis virus, and rabies. With mild viral meningitis or encephalitis, getting plenty of rest, hydrated, and taking OTS anti-inflammatory to ease the pain or headache can all help. In some cases, antiviral medication may be help. Prevention: there is a vaccine of both poliovirus and mumps virus, which can cause meningitis and encephalitis. Practicing good hygiene, avoiding close contact with those who have suffer from this disease, and protect against insect bite can also help to reduce the risk of this disease, and or to reduce the risk of spreading rabies. Keep pet vaccinated and avoid approaching wild animals. Thank you.
Thank you, Shamim.
Welcome.
Now I would like to call Abhilash.
Yes, ma'am.
Abhilash, please present your presentation.
Are you audible, ma'am?
Yes, you are audible, Abhilash.
It's visible.
Shamim, please stop your screen sharing. Shamim. Please stop your screen sharing, Shamim. Shamim, I'm audible to you?
Hello, ma'am.
Please
Hello?
stop your. Please, Shamim, please stop sharing your screen.
Okay, ma'am.
Yeah. Now, Abhilash, you can start.
It's visible now.
No, your screen is not visible, Abhilash. Okay. Take your time, Abhilash. Yes, Abhilash. Please do it fast, Abhilash.
Ma'am, the screen is visible now?
Yes, now it is visible. Now you can start.
Good evening, all. As the topic is viral disease, the viruses are the smallest unicellular organisms that are obligate intracellular. Viruses are the most primitive microorganisms infecting men. They differ from bacteria and other prokaryotes in many ways. Like they are obligate intracellular, they possess either DNA or RNA, but never both. They are smaller than bacteria, can be passed through the bacterial filters. They cannot be grown on artificial cell-free media, but they can grow in experimental animals, implanted eggs, or tissue cultures. Viruses do not have a proper cellular organism. As in agenda, we'll see about the introductions, type of viral diseases, we'll see the summary and we'll hear about the references, what I use. In introduction, as I told that viral diseases are infections caused by viruses. There may be obligate intercellular parasites that have either DNA or RNA as their genome and are covered by a protective protein coat. Also, the viruses occupy the twilight zone that separates living from non-living. By going to the type of virus, there are two types, plant virus and animal virus. Plant virus are mostly single-stranded RNA virus. Their envelope is absent, mainly transmitted by Plasmodium insects and plants. Genome encoded for 3 or 4 proteins, replicase food protein, movement protein, allows cell-to-cell movement through plasmodium and sometimes a protein that allow transmission by only vectors. For examples of plant virus are tomato mosaic virus, cauliflower mosaic virus, potato virus, white cucumber mosaic virus, and many more. Disease caused are leaf curling, fluorosis, blisters, necrosis, and molding. Application used as a vector to enhance the quality and quantity of plants. Animal virus are mostly double standard. DNA virus has an envelope there, transmission by endocytosis, modification in the protein capsid. Disease cause AIDS, polio, influenza, hepatitis, smallpox, COVID-19, and many more. By coming to the DNA virus, there are 10 sequences. Double has envelope and unenvelope. Envelope virus are HIPAA DNA virus, herpes virus, and pox virus. And unenveloped are adenovirus, papilloma virus, and polyoma viruses. And in single-stranded, unenveloped is parvovirus. For in going to the RNA virus, positive unenveloped and enveloped. Positive enveloped RNA virus are coronavirus, flavivirus, and toga virus, and positive unenveloped are calcivirus and picornavirus. In negative RNA virus, we will know about enveloped arenavirus, bunyavirus, filovirus, automyxovirus, paramyxovirus, retrovirus. In positive, we can positive or negative. There are RNA are double capsid, that is a retrovirus. And the positive RNA via DNA is the envelope virus, that is a retrovirus. We are going to the point. There are different types of viruses that can affect human health, like corona, rhino, influenza, and many more. Before going to the animal viruses, we'll talk about plant viruses. The first is the tobacco mosaic. The causative agent is the tobacco mosaic virus. It is mainly transmitted when an infected leaf rub against a leaf of a healthy plant. by contaminated tools and occasionally by workers and contaminated with tuberculosis virus. Also, wounded plants and provide site for entry of TMD. Contains about 6,300 nucleotide. Protein code consists of helically arranged capsules. While looking this drawing, the capsid are mainly of proteins, that are the capsules, and the RNA is helically coiled. By doing the second cauliflower mosaic, causative agent is a cauliflower mosaic virus, which is a double-stranded DNA para-retrovirus. Mode of transmission is an insect vector. Process involved an aphid receptor and two viral proteins, that are P2 and P3. This is a diagram of having a capsid protein and a virus-associated proteins. By putting the potato virus Y is a monoparatotype. Monoparatotype means all genes on one strand. This single-stranded RNA virus that infects mainly solanaceous plants, including potato, tomato, and eggplant, causes yield loss and tuber quality defects in commercial potato crops. Next is the cucumber mosaic. The positive agent is a cucumber mosaic virus. It mainly infects 1,200 species in over 110 families and can cause significant economic losses in many vegetables and horticulture crops. This cucumber mosaic virus causes a systemic infection in most host plants, but many remain asymptomatic in some crops like alfalfa. Symptoms of cucumber mosaic can vary greatly depending on the crop infected at the age of the plant when infection occurs. The left side is the of the negative electron microscope of cucumber virus, and these are the symptoms here. And by coming to the envelope virus, the first is the envelope virus with icosahedral symmetry, which consists of capsid. Capsid is surrounded by a protein core, together known as the nucleocapsid. Some virus also has an outer envelope. Icosahedral are mainly of 20 triangular facets. 20 triangular facets and 12 corners or vertices. Such viruses have a rigid structure. Viruses that are smaller than 50 nanometer may appear spherical under electron microscope. Second is the helical. Helical are liquid acid in the form of a helix or spiral. Such viruses are often flexible. The third is the non-envelope virus with acrorectal nucleoplasm, and the fourth is the non-envelope viruses with helical nucleotides. By coming to the infections, mainly this infection cause mainly the body surface. They enters to lymph nodes to blast. That is the primary infection. Then it again goes to the blood vessels, bone marrow, liver, and spleen, and causes the secondary viremia. When it infects the lungs and the salivary gland and the kidney, mainly the diseases are mouse, measles, and cytomegalovirus. When it infects brain plus nose aging, that is rabies, poliovirus, and measles. And when it affects the skin, that is the varicella. And when it's set in blood, it is a hepatitis B virus. And when it affects the nasal and oral mucosa, it is a measles, varicella, or rubella. By coming to a common cold, it is rhinitis, positive as rhinovirus. Mode of transmission is droplets, fomites, and direct contact. Infect nose and upper respiratory tract, but not lungs. Patients experience nasal congestion, distress, sore throat, hoarseness, cough, headaches, which last for approx 3 to 4 days. Then the influenza is positive as a myxovirus influenza, which is a family of automyxoviridae. Mode of transmission is by droplets. Person experience fever, headache, sore throat, cold, sneezing, and pain all over the body. Or if neglected, can cause pneumonia, such as ear infections. You can see here is that the hemagglutinin is HA, which neuroimmunes are maybe their glycoproteins inserted into the lipid envelope, and hemagglutinin is a triangular shaped and it mainly binds to a mucin or sialic acid receptor or RBCs, result in clumping of RBCs to plus in agglutination. And neuraminidase is mushroom set and present in fewer number than HA. It is as sialase enzyme that degrade the sialic acid receptor on RBCs. Coming to smallpox, the positive is the variola virus, mode of transmission by media droplets and fomites. Patients suffer from fever, cells, headache, followed by appearance of less on child weakness. Results start at reddish spot when become fluid-filled pulse. Cases of smallpox are more in face compared to body. First, it will occur on the face, then it will transform to whole of the body. When coming to chicken pox and shingles, positive evidence of varicella zoster virus, mode of transmission is direct contact. It's just like appearance of skin. More is on the chart that on feels is recurrence of chicken pox. Means mainly it will be occur on the trunk or the body, then the face. This is the picture of the smallpox and chickenpox. Measles, coming to the measles, the positive as the rubella virus, more than transmissions of droplets, symptoms, fever, process, rosy dead resistance, this is the mouse measles rubella vaccine as provided now. Moms positive as a part of virus, more than transmission is droplet or saliva. Means in here the parotid gland is parotid gland is getting swollen in this case, and in some cases infection of testis that is orchitis also occurs. In coming to rabies, it's a virus, mode of transmission by the infected areas, dogs, flickers, or balls, etc. Symptoms: headache, excessive salivation, muscle spasm, paralysis, mental confusion, surgery. Hydrophobia is also seen. And treatment is anti-rabies vaccines that are available nowadays. Poliomyelitis, positive evidence of poliovirus, family coronavirus, mode of transmission of or by houseflies, it enters the body by alimentary canal, multiplies and releases the nervous system through bloodstream. Was introduced, poliomyelitis was introduced by government of India in 1994. Includes annual vaccinations of all children under the age of 5. Initial symptoms involves inability to pant, head followed by stiffness of neck. Also, the small can Sabin introduced the polio vaccine. And dengue, the positive agent arbovirus, flavivirus group, more transmissions of by the female Aedes aegypti, is a tiger mosquito, two types of dengue, classical dengue and emergency dengue fever. Classical dengue occurred mainly on the high fever, rash, back pain, muscle aches, joint pains, and headache sensation. In the emergency fever, you will see the bleeding disorder, weak pulse, excessive thirst, and difficulty in breathing. But this is the conditions, dengue fever. And when it comes to chikungunya, positive agent is a chikungunya virus. Mode of transmission is a bite of Aedes mosquito. Sudden onset of fever, crippling joint pain, then urinary conjunctivitis, and in exchange to this may lead to hemorrhage. When coming to hepatitis, we'll see about the inflammation of the liver, which can be caused by virus, drugs, and platelets and alcohol. There are 5 types of hepatitis A, hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Hepatitis A and E are mainly transmitted by fecal and hepatitis B, C, D are mainly by blood sexual contact. By going to hepatitis A, this infectious hepatitis, mode of spread is by fecal or road, mild disease of children and young adults, that is one anorexia, others diarrhea, fever, chills, eventually diarrhea. So, this is causes jaundice, fever, dark urine, pale food, nausea and vomiting, joint pain, etc. Vitamin hepatitis B is serum hepatitis. Positive agent is a hepatitis B virus. Mode of transmission, blood transmission, sexual contact, also spread saliva and tears. Symptoms include bleeding of eyes, abdominal pain, dark urine, in chronic cases, liver failure, and cancer may occur. When vaccine is a recombinant hepatitis B virus, hepatitis B vaccine. Symptoms are hepatitis B, Will be the dark area fatigue, abdominal pain, loss of appetite, jaundice, joint pains will be seen, nausea and vomiting are seen, etc. And hepatitis C is a positive in hepatitis C virus. Clinical similarity hepatitis B and often transfers by blood transfusion. And these are the symptoms: stomach pain, vomiting, yellow access, spread through candida, spread through contaminated blood, sharing care items, use or share needles, unprotected signs. Also, they also progressing protein hepatitis is a high infection because liver, meaning the liver inflammation sometimes leading to serious liver damage. Hepatitis B is the delta hepatitis, positive as in is the hepatitis B virus. Mode of spread is the blood transfusion, sexual contact. So I got years, clinically similar to hepatitis B, has higher fatality rate than of the hepatitis B infections. So there is symptoms of hepatitis showing fever, jaundice, simultaneous inversion of the spleen and liver, physical weakness. Hepatitis B, mode of transmission as well fecal or elbow. It doesn't produce chronic diabetes, chronic or jaundice, that are the nausea and not moderately rate pregnant.
Abhilash, sorry to interrupt you, Abhilash, but your 15 minutes are over.
And two slides, two slides.
Please wrap up fast.
And then come to HIV, the human immunodeficiency virus, mainly mode of transmission, sexual contact and blood products. The virus mainly affects the helper T cells of the body and the family is with symptoms of HIVs. Having come to coronavirus, it is mainly the pneumonia and it will usually associated symptom. It is occurring in the area of the blood and then SARS is a severe respiratory symptom. It is single strain RNA virus and when to come to the COVID-19 guidelines version 2, the most common symptoms are fever, cough, tiredness, loss or testosterone, and less common symptoms are sore throat, headaches, aches and pains, diarrhea, etc. My reference are Anand and Google. We will further in accessible mention methodology or biopregnancy history. Thank you.
Thank you, Abhilash. Now, I would like to call Swapna ma'am to please give us review about the competition.
No other participant?
No, ma'am, it was the last participant.
Oh, I think that person 10 were there, only 7.
Ma'am, sir, yes, ma'am. The other members have some unavoidable reasons, that's why they are not present.
Oh, okay. I thank all the participants for their nice presentations. Some were very nice. I mean, they did this in detail, and some presentations were not so nice, not so good, but taking part is very important. So there will be one first and second and third. Some winners will be there, but all the participants they have put in their effort. So I think that is very important. So thank you, Preeti, for conducting this whole thing so nicely. And we will send our marks and feedback, me and Richa ma'am. So that's it. Thank you.
Thank you, ma'am. Now I would like to call Richa ma'am to please give us review about this competition.
Thank you, Preeti, and thank you all the participants for such lovely presentations. As ma'am said, some were good, some were not so good, but taking participating in such an event is the most important thing. It builds your confidence. It gives you more exposure because participate.
So we all are done with the event, and I hope we all gain some knowledge and experience from this event. We will conduct these types of events in future also. so that each student and participant will get a chance to show their skills. Before ending this meeting, I would like everyone to please turn on their camera so that we can capture this beautiful moment. I request everyone to please turn on their cameras. I request all the participants to please turn on their cameras. Okay, you all can turn on the cameras. Thank you. Before ending this meeting, I would like to thank our Chief Organizer Sharad Bhaiya, our judges Sapna ma'am and Richa ma'am, our executive team members, and our participants for making this event so successful and conducting this event smoothly. So now we wrap up this event here. Thank you all for making this event wonderful and interactive. Thank you, everyone.
Good night, everyone.
Good night, everyone.
Thank you. Good night.
Thank you, ma'am.